Do you know how to answer questions on the NCLEX? Let's try it with these 35 questions that will stimulate your mind. This is designed to focus you for your exams. And if you're taking your exams in the next few days or weeks, I really encourage you to watch this video and look at the questions, how I'm going to answer them, so that when you see similar questions, you can attack them in the same fashion. So take a look at it and stick around. 35 questions. You can watch it in segments, but very good questions to stimulate your mind. Let's go. First question is a prioritization question. As usual, you should not be surprised. I like prioritization. Who needs to be seen first? A nurse is caring for 4 clients, chest tube. So all of them has chest tube. Who has to be seen first? You have to be sharp. Being sharp is specifically taking care of a breathing patient, electrolyte shock, hypothermia, airway, neurological problem, and pain. But this is the same thing. So just to say, a patient who has a breathing issue, has a chest tube, we got to figure out content is being applied here. For prioritization, divide the questions into two. Read the first portion and see what happened to the second portion. A client with what? Intermittent bubbling in the water seal chamber. Chest tube is divided into three. Okay, this is the collection. This goes to the patient. Okay, this is the suction. It is connected to a suction. And this is the water seal. This is what prevents air from escaping into the patient. It allows air to move from the patient and go this way direction. And so we should have some water here. Once in a while, you see some small bubbling because it was placed because of chest and pneumothorax. Intermittent bubbling is normal. Sometimes when the patient coughs, you see intermittent bubbling. But if there's continuous bubbling, then that's wrong. So this, we don't need to see these patients. A client with continuous bubbling in the suction, you see, you got to pay attention. Continuous in the suction chamber. Here we bring in suction into the system. So you should see bubbling in the suction chamber. If you don't see bubbling there, then there's something wrong. Therefore, you should not see this patient. A client with no bubbling in the collecting chamber. So this is the collecting chamber. You're just collecting fluid from the patient. There should be no bubbling here. There should be no suction, nothing like that over here. With this, we don't need to see. It's unexpected time. The client with no bubbling, but dry water seal chamber. So the water seal chamber here, you're not supposed to see bubbling, but if you see bubbling, you're going to see what? Intermittent bubbling when the patient coughs. There's no bubbling, but that's good. But what is the problem? It's dry. There's no water. No water. There should be water there so that it can act as a water seal chamber. But there's no water. It's dry. So that one we need to intervene. Even though it has no bubbling, which is good, but it's dry. There should be water up to a certain level to help act like a water seal chamber. This is the first question to stimulate your mind, as I promised you. Let's go. Second question. Select and apply. Test taking strategy. Reading the question from the back. Okay. Which of the following can be delegated to UAP? The nurse is caring for a client who is post-op day one. Which is post-op day one? Which one can you give it to UAP? I say UAP will do things. No thinker. That's the way I see them. Even though they're very smart for your exams, think about it that whatever they do, that's not the right thing. Measure a urine output, no brainer, right? They can do that easily. Monitor, the word monitor changes everything. You have to monitor patient pain level, you try to do assessment. It is done by the RM. RM do evaluation, assessment, and teaching and high maintenance medication. and the and the LPN do MMR most. That's my acronym. Where they monitor whatever RN find. Okay, they can give most medication. They reinforce the teaching R. They can take care of stoma and tube feeds, special tests, and this is the tube feeds. Therefore, or tracheostomy or stoma, whatever, that's what they can do. Educate is E, belong to RN. They can. So educate patient on the use of incentive spirometer that require an assessment. So they can do that. Provide Foley care. If they can measure urine output, and they should be able to take care of your Foley. It does not require anything. Document vitals. They check your vitals all the time. So 1, 4, 5 is their job. Straightforward delegation question. If you get this down, any delegation will be easy. That's the way you attack it. Number 3. Like once again, test taking strategy. We're going from the back. Which of the following need immediate intervention? Those are my buzzwords. They buzzing in my ear. A client presented to the PACU after 6 hours of abdominal surgery. He just had surgery. He came to the PACU. What do you expect? 6 hours of abdominal surgery. There should be no valve sound, hypoactive valve sound. Does not need a follow-up. Small blood stain on the dressing. If this is the incision, you have a small blood stain here. Does not need a follow-up. His heart rate is 80. It's not Brady, but it's all the anesthesia on board. The heart rate will be low. Usually temperature is also a little bit slightly low. Confusion, I don't like it. Completely confused, yeah, it's not a good idea. Maybe due to hypoxia or something like that. No void for 6 hours. Yeah, usually we let somebody go 6 to 8 hours. Surgery after surgery, 6 hours is fine. If you put a Foley, you can go 6 to 8 hours. But in the PACU, 5 hours, they've no pee. Don't worry about it. It should be fine. I'm worried more about this neurological problem than this. Next one, select or apply. Which of the following need immediate intervention? Once again, something that I immediately need to intervene right away. A nurse is caring for a newborn receiving phototherapy. Why would a newborn? You got to bring your content with you. This is a buzzword. This is a buzzword. This is a buzzword. When you add them together, what is the rewriting the question? Kid getting phototherapy. What should you worry about? What they're being exposed to UV light in order to break down the bilirubin. Otherwise, they will develop brain injury, connectorates. So because of that, we need to monitor them for brainstem neurological problem from the high level of bilirubin. When you give them phototherapy, break down the bilirubin and they pee and they have bowel movement with that. So you expect the urine to what? To be yellow. So this does not need any intervention. The scleral ectrates is going to be also be yellow, even though it says increasing. It's going to, as the ammonia, the bilirubin breakdown, it become more yellow, but it get better. Permanent upward gaze, that's a deficit due to some brain injury. So this, we need to intervene. 8 wet diapers in 2 hours. Oh, the kid is peeing from the, so this we don't need to intervene. Mother apply lotion to the body. Yeah, the kid, this is the kid. Okay, he's being exposed to UV light. The only place we cover is in their genitalium and their eyes. We cover their eyes because we prevent retina damage. So it's nothing wrong applying lotion to help with the heat loss. We don't need to intervene. Wearing eye protection, I told you, retina hemorrhage. So that's good. So only one answer. In selected applying new generation strategy is usually plus minus scoring. If you get it wrong, they will take a point. So what you need to do, you pick those you're confident. If you don't know, just leave it. No guessing anymore. If you know all of them and you know all of them is right, I want you to pick it. So we already have one answer here. Number 5. The next should include which of the following? Select or apply. The same thing. So I know I got to include something, right? And nurse is caring for an asthma patient, prescribe oral prednisone due to recurrent attack. Patient want to know the adverse effect of this medication. Buzzwords is what? Steroid, an asthma patient, and I want to know side effect. If I give you steroid, what will happen to you? Steroid is notoriously bad in terms of it deposits fats. If you deposit fats, you gain weight. So weight gain here. Through deposit is a stress hormone. As it stresses you up, it increase your glucose. So hyperglycemia. If you make you gain weight, you deposit fat, you have dyslipidemia. So this is where we have it. Okay. It's an immunocompromise. It makes you immunocompromised. Because of that, you have high rates of infection. So what will you do? You got to be careful. It also causes ulceration of the GI tract, and this will make you bleed. So you got to avoid NSAID. So gastric ulceration. It leads to bone breakdown. So it causes osteoporosis. It's also a mood. It affects your mood, probably because of all these things that happen. It causes depression. So mood disorder. So these are all side effects of steroid that you're supposed to know. I give you everything in case you see it next time. You know these are the side effects of the steroid. So she should include all of them as possible answers. Number 6. Which allergy will be prioritized? Select or apply. And this is doing assessment to a new patient who need admission. This patient need admission. Which allergy is more important? Okay, say they have kiwi allergy. They say they have banana allergy. They say they have peaches allergy. They say they have grapes allergy. They have tomato allergy. And they have latex allergy. Guess what? All this, if you have these allergies, you have latex allergy. So all of them is associated with latex. If you have kiwi allergy, you will develop latex allergy because of the ingredient. If you have banana, peaches, grapes, and tomato, all of them will cause latex allergy. So all of them should be included. So there's the should be included in the evaluation. So we got to worry about them. 7. Which precaution is appropriate? A nurse is caring for a client diagnosed with pneumonia, trying to make the question simple, straightforward, as you see in the board, but very loaded. So if you have pneumonia, what kind of precaution will you give? This is a trick question. When they just have pneumonia, they don't tell you the organism that is involved. All they do is a standard precaution. People who have pneumonia, we just do standard precaution in the hospital, unless we know what kind of pneumonia. If they said mycoplasma pneumonia, yeah, you know that is a droplet, okay? If it's a TB, it's a TB pneumonia, it's airborne. So it depends what kind of, if it's the adenovirus pneumonia, yeah, it changes. So whatever, if they give you the organism, yeah, then you go with the organism. But for now, it's just pneumonia. It's a standard precaution. So that's trick. It's appropriate. You just do a standard precaution for that. Second one. Number 8, the same term. just to give you guys some clue. Which precaution is appropriate? And this is caring for a client with HIV admitted for chest pain. The CDC says HIV is a standard from CDC. This is a standard precaution. There's no airborne, there's no droplet, there's no contact. So if you're taking care of an HIV patient or you see it in your test, just put standard precaution. It's not droplet, airborne, contact. It's just standard. Okay. Number 9, which statement need immediate intervention? Select or apply. As you can see, I read from the back and I know what I'm going to do. It's a select or apply and I need intervention. And this is caring for a client receiving Azathioprine and then infliximab. Pharmacology, you have to recognize the medication. There's no way you can answer a question of pharmacology without recognizing them. So I want you to pay attention to them when you look at them, picture them in your eyes and say, this is what it is. I know this medication. Of course, you're not going to know all medications on the boards, but the key one is what I like to give you. And that one you have to recognize it. Look at it. He has a map at the hand, infliximab. And this is a terpene, some purine derivative, you can derive it, purine derivative, something. So, purine is in your DNA and also something has to be immunomodulated. You have to affect replication. You have to affect your system. So these two medications are immunosuppressant. So it suppresses your immune system. And they use it for ulcerative colitis or other autoimmune diseases. All this is saying is you're taking some autoimmune medication, which one need immediate intervention, patient is immunocompromised. Then you teach them neutropenic precaution. That's what it is. So neutropenic precaution. I will be gardening tomorrow, negative. You can't garden. So you need intervention. I bought some fresh vegetables for salad tonight. You can't have fresh vegetables. That's bad. I will have water bottle when I go out. Yes, they're not drinking from water fountain, so this is good. So that does not need intervention. I have postponed our Disney trip to next year. Worry about the crowd, so that's good. Excellent postponement. And hygiene is a priority. So the more you wash your hand, you pay infection and you don't have any problems. So this is good. So I don't need to intervene. No need to intervene. No. So first two, I have problem for a neutropenic precaution patient. Number 10, select or apply. Which precaution is appropriate? Same thing, same strategy. I just want you guys to be comfortable in terms of precaution and room assignment and other thing. And this is caring for a client with adenoviral pneumonia, like I told you. So we have a pneumonia, and then we have an organism. These are the bars with adenoviral. That means it's adenovirus, right? We already know adenovirus is contact. And they also have pneumonia involving the lung. Therefore, this also has to involve droplet. So for this question, you don't need contact, you need a droplet, and then you need a standard. No, sorry, you need a contact. Okay, you need a contact because it's a contact precaution. You need a droplet because it's a pneumonia, and everything that involve any organism, we also institute standard precaution because it's part of it. Whether you're doing contact or not, we're doing standard. This is select or apply. So you got to put the standard. So involve every precaution they give you, just imagine that involves standard. And then if they give you just specifically to what you wear, yeah, then they're asking you specifically for the organism. But this is just a sector you can just put and consider standard precaution as one of them. So contact, droplet, and standard precaution. The key one is that one, but we still can institute standard precaution in other things. So you still have to wash your hands and do the things you're supposed to do. As a name, so it's part of the standard precaution. Number 11. A nurse is caring for a client diagnosed with osteoporosis after a DEXA scan. Which teaching is appropriate? So which one do you think is appropriate? Keywords: osteoporosis, appropriate teaching. Osteoporosis, appropriate teaching. That's all. What do you need to teach for these people? Improve their calcium. You can give them bisphosphonate, alendronate, those to prevent bone breakdown. You can let them take some calcium, let them take vitamin D, expose themselves to the sun. That will give them some vitamin D, and indirectly will do that. Exercise, moderate exercise, basically 3 times a week, and just each time just 30 minutes. Then these guys, high level of calcium is their friend. So avoiding exercise is wrong. You got to exercise. Do you take calcium supplement? Yes. But look at the answer. This is the test taking strategy. You have to look at the whole totality of the question, answer choice. They will trap you and you get it wrong. You see calcium supplement and you pick it and you forget about it. You keep on moving on. They say on empty stomach. You don't need to take calcium on empty stomach. With food, food will increase absorption of calcium. So this question was a trap. Answer choice is the trap. Limit alcohol. Yeah, you should not drink alcohol. And that will help with the osteoporosis. So limit alcohol is wrong. It just has to be avoided completely. We already had osteoporosis. There's nothing like limiting anymore. No more alcohol. So the right answer is eat green vegetables. There's a lot of calcium in it. Freshy, green leafy vegetables, high source of calcium. So that's number 11. Number 12. Select and apply. Same thing, right? A bunch of startup questions. Which lab work indicate the client need additional nutritional support? So need, and we're looking for additional. Nurse is caring for a client with several years of COPD, and the lab work, which lab work indicate the client need additional? So which of this means I need nutritional support? That's all. Don't forget about the COPD or anything like that. Test taking strategy. That's why you read the last portion. Which of these lab work indicates I need additional nutritional support? There is 3 lab work you're supposed to know. Okay, transferring, prealbumin, and albumin. Albumin, it tells you about 21 days how good your nutrition is. Prealbumin, usually 14 days. And transferring, less than 7 days. So 2 to 3 days, it can tell you your nutritional status. We like to use the prealbumin, albumin because it's easy. Transferring is sometimes difficult to get. But these are the nutritional lab. Albumin takes 21 days to give you some idea of your nutritional status. So decrease albumin, decrease prealbumin, and decrease transferring, all indication of malnutrition. These 2 does not apply. If BUN decreases, yeah, that elevated means you have enough protein on board. So that's not a choice. So 3, 4, 5 are the right answer. Next question. The client wants to know more about the disease. Which teaching is appropriate? What is the problem? A nurse is caring for a client diagnosed with thromboangiitis or Buerger's disease. thromboarthritis obliterans, Buerger's disease. So what do you wanted to know more about the disease? Then you said Buerger's disease. What content do I need to know to provide teaching for this patient? Buerger's disease, number one risk factor is tobacco. And it's a vasculitis of the small to medium vessels. And there's decreased blood flow, so they get auto amputation and ischemia of the lower extremities. So vasculitis is like Kawasaki, but involves smaller vessels, of small and medium vessels. And the number one reason why this happens is inflammation from tobacco. Because of that, the treatment is to stop smoking. As soon as you stop smoking, symptoms will improve. Because of the ischemia to your toe and your fingers, they will die and they will auto amputate. That means they'll cut off. Because the blood flow, you see, if the blood flow going to this leg is very small, you will have poor tolerance to cold, because when it's cold, you cannot warm yourself. Blood is warm. Blood cannot go down there to warm your fingers. And so when it's cold, you can take it. If you're walking, you will ask for more blood, but the vessels are all small and inflamed by the tobacco. So you develop claudication. And your doctor may prescribe bupropion. This is an antidepressant, but it's very good. It helps with the withdrawal symptoms of smoking. So we can use it for smoking cessation. Of course, he has a high risk of suicide, so you got to pay attention. And it make you hyper. So, but it's very important. You can use it for smoking cessation because it helps with the withdrawal symptoms. As you're craving for tobacco, this will help with that. So all of this is the content. I just put it there for you. In case you see this question in a case from all this team management, that will go there. This is the topic for Buerger's disease, everything you know about that disease in one question. Okay, what do we have? Which drug was responsible? Okay, who is the problem? A client with schizophrenia was brought into the emergency room due to failure to drive. The client pushed the carrying nurse during assessment. Client was chemically restrained. 4 hours later, client was febrile to 103, heart rate 120, and that's muscle rigidity. This is no-brainer, right? You came in agitated, I give you a medication, and all of a sudden your temperature is 103, your heart rate is 120, and you have muscle rigidity. What do you think? Classic, the clue, the buzzword is schizophrenia. So he has to be a psych patient who need to be sedated. Sertraline is an antidepressant. You don't use it for sedation. Selegiline is a monoamine inhibitor, also antidepressant. You don't need it. Haloperidol, yes. It's the class 1, first generation antipsychotic, the typical guys. And they caught, what is your diagnosis? NMS, neuroleptic malignant syndrome, temperature high, tachycardia, muscle rigidity, autonomic dysfunction. This is deadly. That's a priority. Be sharp, number 1. You got to see this patient. And the treatment is dantrolene, so this is good. Amitriptyline is TCA. So that's also an antidepressant. It has high anticholinergic effect, but this is not one of its side effects. So 3 is the right answer. Number 15, selected apply. An nurse is caring for a 15-year-old client diagnosed with hemophilia B. There's A and B. Which teaching the nurse should include at discharge? So buzzwords, you have to find the buzzwords. Hemophilia, it doesn't matter whether it's B or A. And I need a teaching I should include. This is a bleeding disorder. This is the key. Therefore, your own teaching is to stop or prevent bleeding in this patient, because they cannot clot. If they're bleeding, they can't clot until you give them the factor that they need. So why would you give them Motrin? So avoid Motrin. That's good. Why do you want to give them IM injection? You inject it into the muscle and they bleed. We do only sub-Q for these people. So avoid that. Avoid swimming. Swimming is a non-contact sport. So they should not avoid it. They should avoid contact. Avoid contact sports. Swimming is non-contact. So this is wrong answer. Medical alert bracelet. Yeah, they should have something on your body so that we know they are hemophilia B. And when they're bleeding, we can take care of it. Avoid tennis. Tennis is another non-contact sport. It's non-contact sport. So the patient should be able to do it. They should not avoid it. Use soft Bristol toothbrush. Yeah, so that you don't bleed in your mouth. So the whole question, you see what I did? I just took bleeding and I use bleeding as my key. I don't go back to the question and figure out again. Bleeding, bleeding. Everybody, you got to stop bleeding. So that's what we have. Number 16, select or apply. Which precaution is appropriate for these patients? You already talked about some of them. HIV is standard, right? Hepatitis B is also standard according to CDC. Hepatitis C, standard. So this is good. Hepatitis A, that has no incontinence, is standard precaution. If they have incontinence, it becomes contact. CMV is standard precaution. You can see what I was trying to do. Aspergillosis is also contact. It causes bore, pulmonary bore, but it's not anything. It doesn't know, you can't transmit it to anybody. It's a standard precaution. E. coli, 0157. I told you, if you listen to me, I said this, you look at it, this sound like enteric to you. So it goes to the enteric family. So this is wrong. This go into contact precaution. So this is the way they can, sometimes they can set a question. So which one is appropriate? There's only one that was appropriate. The rest of them are wrong. So that's the one that is appropriate. 1, 2, it's not. 4 is not. 5 is not. 6 is not. 7 is not. Okay. Select or apply. Which of the following need immediate intervention? Okay, something is wrong. I need to need intervention. Nurse is caring for a 28-year-old pregnant client with pre-eclampsia who is receiving magnesium. So buzzword, 28 weeks, and then getting magnesium. That's all, 28 weeks, magnesium. And no, magnesium, usually, if you have pre-eclampsia, it lower your excitability. So think about it, magnesium and calcium, higher level of calcium will slow things down. When you have low calcium, everything is up. The same thing, high level of magnesium, things go down. Low level, everything's go up. So we use it for pre-eclampsia to prevent them going into seizure, becoming eclamptic. When you're on it, you have to monitor it. Okay, if everything go too down, you have magnesium toxicity. If things are going up despite that on magnesium, it means the medication is not working, or you have to go up on the medication. So we want the deep tendon reflex to be 2. That means we want it to be normal. So when we put on this, we're trying to make things normal as much as possible. So deep tendon reflex of 1, yeah, we got to intervene. We want the respiratory rate to stay above 12. This is less than 12. So we got to intervene. We want the ASAT to be above 95. This is, so you want it to be greater. This is less than 95. So we got to. And the neurological status is bad. Deep tendon reflex is 3. That means it's bigger than it's higher than the normal. It's so clonus. That means they're getting what? The medication you're giving them is not doing the job it's supposed to do. And so they are high risk of seizure. Still, you still have to see them because you put them on magnesium and their reflex is going up. They're about to seize and go into eclampsia. So you still have to see them either to titrate your medication as soon as possible. So those are the things you watch for. Even though it's +3, it's the opposite way because you still have to see them needing to function because you have to titrate you're not doing good. If you're going low, if the physical exam show things that are going down, that means you're overdosing them. If the physical exam shows things are going up, that means you are underdosing them. So you have to go up on your medication. So that's for that one. And this is caring for a 4 pregnant client at outpatient OB who need HCP notification after the test. So it's taking care of 4 of them. Who do we need to see? And then when we see them, call the doctor to be seen. So there's a bunch of stuff here. Non-stress tests and contraction tests. I just do it easy. I'll draw a table when you see this and put, okay, non-reactive, reactive, and then, or just, yeah, non-reactive, reactive, and do plus minus here. Okay, so what you do is, or you can do it different way. Okay, you do non-contraction test and contraction test into 2. So I don't want plus or minus. Let me just clean that one. Sometimes it's a easy way is look at it. For non-contraction test or non-stress test, okay, non-stress test, this is the deal. It's non, so we are not stressing the mother. And so the mother and the baby is doing something without we not stressing them. And so non-stress test, we are looking for the baby to accelerate. I want you to accelerate. If you accelerate, you are reacting. If you know acceleration, you are non-reacting. That's all. So this is the problem with the non-stress test. I want acceleration. So I want you to be reactive. If you are non-reactive, I don't like it. Then contraction test. This one, we give the mommy something and we want the mommy to contract, see, and stimulate the mommy to contract and see if the baby can tolerate the contraction during birth. Okay? During birth, what happens? When the mommy contracts, there's blood flow, there's changes, the placenta get into trouble. So we look for deceleration, acceleration, or variable decel and those things. When we deceleration, we don't like it. Okay, when we see deceleration, we don't like it. And therefore, what do you think? So I don't want to see what? Deceleration. If I see deceleration, it's positive. No deceleration is negative, which is good. So for contraction test, I want a good one. Negative, no deceleration. For non-stress test, I want you to react. So that's the way to do it. So non-reactive for non-stress test is not good. I want you to react. Reactive for non-stress test, excellent. Negative for contraction test, excellent. If your positive means there is a deceleration for contraction test, I don't want it. And these are definitions. Increase in heart rate by 15 beats per minute over the baseline for at least 15 seconds within 20 minutes time frame. All it means is within 20 minutes time frame, the baby heart rate goes up and remain there for 15 seconds, then come down. That's all. So within 20 minutes, baby heart rate go down up 15 over the baseline and stay there for 15 seconds and come down. That's acceleration. Baby is reacting, and that is reactive non-stress test. So this is what we see. Deceleration more than half of the contraction. That means there is the half of the, if 220 contraction, you're getting deceleration more than half, like 70% of them. And you know, when we see deceleration, what does that mean? Yeah, the contraction test is positive. So this is what this is not good. Deceleration more than half, this is the same as what? Positive contraction test. So I don't want it. I don't want to see this, but I intentionally did it this way. Then we go back because then you understand. So this one that I cancel them are the one you need to call the HCP. The non-reactive non-stress test is bad, so we need to call the ACP for this. These ones are good. Positive contraction test is a bad one, so we need to see the doctor for this. This is a good one, so this. So the one we need to notify, the question said notification is 1, is 4, and is 6. This is the hardest question among all, but if you know, you can answer it quickly. Okay? That's it. Number 19. Which teaching is appropriate? Select or apply. A nurse is caring for a client with constipation. Okay? Alternating with diarrhea. Client has history of anxiety. This may be a case they can give you, but summarize it. I do not want to give you too much information. What are the buzzwords? Constipation. Alternating with what? Diarrhea, right? And I have a history of anxiety. What do you think? Diagnosis. This is irritable bowel syndrome. What teaching you tell them? Avoid stress. Okay, exercise, do some yoga, and avoid gas forming food. Okay, so these are all gas forming food. So you should avoid all. Then this is the teaching you provide to IBS. Avoid these gas forming products, exercise to reduce your stress, and then do some yoga. These are all exercise realization technique. So that's what you do. All of them are right. Number 20, almost there. Select and apply. A nurse is caring for a client with stroke at the Buerger area. Which of the following the nurse should expect and include in the plan of care? So a couple of things. Buerger area, and I need to indicate if I expect this, and then some teaching I should provide, or in my plan of care I should include based on that. I do this easy way. This is hard, so it's hard for people to understand. So I have an acronym, Buerger, okay? So I have the beef, okay? So that's the way I call it. Buerger area is beef, where B is the Buerger area. E is expressive aphasia. So E and A is expressive aphasia. And F is the frontal lobe. So that means the frontal lobe is damaged and they have expressive aphasia, and it is located at the Buerger area. That's the name of it. So damage to the frontal area. Yes, if you write this, you know everything. Expressive aphasia. Yes. What is expressive aphasia? Is this client with short, limited phrase, because they cannot express themselves, so they will use short words to engage you. Yes or no answer choice is what all they can say, but their comprehension is intact and they know what is going on. So the keyword is beef for Buerger area. If you write it, you can be able to answer any question related to this. And then to complete everything, I just want to give you all the content. Which of the following should the nurse expect and include in the plan of care? A nurse is caring for a client with stroke at the Wernicke area. It's normal Buerger is Wernicke. So Wernicke, I call it rat. Where W is the Wernicke, R is receptive. Receptive aphasia. That's RA. And T is in the temporal lobe. So the disease is in the temporal lobe, and we have receptive aphasia. So damage to the occipital lobe is not true. They have what? Receptive aphasia. Their expression is not affected. So this is not true. They make up things because they have reception. They don't know what you're talking about, so they make things up. They speak. They can speak. Expression is fine, but understanding is affected. So that's why it's called receptive. So they make up things. They confabulate. They are not aware of the problem. If you drink alcohol for a long time, this is the area that is affected. Wernicke encephalopathy. That's it. That's my cheat sheet for Brocky and Wernicke area. Pharmacology. So this is both Pharm, right? Select and apply. Which side effects the nurse should include in the teaching? A nurse is caring for a client who was prescribed promazine. I want you, if you're watching up to here, I want you to pay attention to what I'm going to say. They like giving you these medications. Look at the last name, Zine. If you see a medication that has his last name, Zine, even if you don't know, trust me, most likely they've given you an antipsychotic. So this is antipsychotic medication. And this is the typical one, the first generation, the allopurinol family. Most of them has the last name Zine, Z-I-N-E. They all know that we know allopurinol. So sometimes they will not give it to you, the Aldol, okay? They won't give it to you, but they will give you this Zine, those family names with Zine. As soon as you see it, it's antipsychotic. And then you change your mind. You don't even care anymore, whatever medication. You just pay attention, antipsychotic. What should I worry about? Every antipsychotic, you have to know these things. They all have anti-histamine effect, so they make you drowsy, okay? Anticholinergic effect, dry mouth, constipation, urinary retention, pupillary dilation, all of them, okay? Neuroleptic malignant syndrome. You give it to you, your temperature goes up, you have muscle rigidity. We saw a question like that. They have extrapyramidal side effect, why they look like Parkinson patient. And they have Parkinsonism. They also causes a granulocytosis. It's not clozapine alone. And then the next one, they have photosensitivity. I want you to like picture this in your head. Every antipsychotic, he said, these are the side effects. There's few that is specific to each. Some of them, the second generation cause agranulocytosis more than the primary, but this is common for every primary. And watch for the last name. They may have florfenazine. All of them have zinc as the last name. If they give it to you, you can't recognize the medication on your NCLEX. Look at the last name and see if it says zinc. If it says zinc, it's antipsychotic. So this is all should be included in the teaching of the side effect of the antipsychotic. Norma 23. Which assignment is appropriate? L&D nurse flow to the cardiac unit. Okay, we have a problem. Labor and delivery nurse, cardiac unit. Okay, which patient will you give it to? A client with unstable angina on a tele. The patient is unstable. She has no clue what to do with unstable patient. Patient is unstable. The word unstable could disqualify from giving to a floater. Experienced nurse should take care of this patient. Client 2 hours after a cardiac bypass. Experienced nurse, because there's so many things that need to be done. Drip, IV, everything. Titration of those medications is too much. You want to give the nurse non-specialized job, okay? So if somebody is floating, look for non-specialized job. A client with MI admitted 48 hours ago and normal troponin. A client was admitted 48 hours ago, no chest pain, the troponin is resolved. Usually, these are easy patients. You just manage routine vitals and other stuff. Oh, troponin, that's normal. So this sounds like appropriate. A client ready for discharge after liver transplant. This sounds like benign, but it's more dangerous. Liver transplant patient, they have like tons and tons of medication. They require teaching, follow-up, things they need to look for. I don't think a floater is appropriate for this patient. That's not appropriate, so we should not give it to the floater. You need experienced nurse to teach the patient complication, what to look for, and all those things. Okay, so that's that one. Which of the following need immediate intervention? An alcoholic was being discharged from a rehab on disulfiram. You know this is coming, right? Alcoholic, get the disulfiram. Which one you need to teach them and say, hey, stop, you can't do that. Disulfiram is alcohol aversive. So that's the idea. He wants you to be, not to drink. If you drink, you're going to get sick. So that's the idea. I love ice cream. I don't see alcohol in this. Peanut jelly is my breakfast. I don't see alcohol in this. I can go with that, or I can't go with that orange juice. I don't see alcohol in this. But vinegar, there may be some alcohol. And these are the people you teach them. A drop of alcohol can cause a problem. So every food that has alcohol in it, yeah, avoid it. Even if it's a little, 0.00%, yeah, still you should avoid it. It's a lot of pride. Clients sustain femur fracture that require a cast. The caring nurse should notify air care based on which finding. So somebody has a cast, I'm breaking it. Which one of the following will you notify me? I'm telling myself, notification, notification. I have a cast. Who? If my toe is warm, I'm good. If my pulses are even above normal, I'm good. If I just have 1 out of 10 pain, I'm good. If I have toe paresthesia, I'm not good. If my feet is cold, I'm not good. If I have pain with dorsiflexion of the foot, I'm not good. Those are early signs of compartment syndrome. So that is the way you go through and said, is it good or not? If not good, then you choose it. But 4, 5, 6 are not good. Another select or apply. Like I told you, all the cases, most of them select and apply. Which of the following the caring nurse should knows is consistent with the diagnosis? What diagnosis? 20-year-old presented to the emergency room with abdominal pain. LMP, last menstrual period was 6 weeks ago. The physician suspected ectopic pregnancy. So keyword, ectopic pregnancy. So ectopic. So which one is consistent with the diagnosis? Well, if this is the body and the uterus is here, there's ovaries, this is the adenine side. So you have 2 tubes. There's no way, I've never seen a bilateral bone pain. That means you have 2 implants outside, both on the left and the right, and then both of them are ruptured. I'm not sure. Usually it's unilateral. No, unless you have you have twins, and then both of them are ectopic. They never get into the fallopian tube to the uterus. So they are not bilateral, but they are unilateral. Vaginal spotting, yeah, you can bleed. Shoulder pain, yeah, it depends. If it's on this side, you go to that shoulder. If on this side, you go to that shoulder. So left or right shoulder, depending on where the ectopic pregnancy is located. Tachycardia, yeah, patient is infectious. Probably they may be in shock, bleeding. Yeah, they will show tachycardia. And if leukocytosis is similar, your white count will go, all the inflammation going on. No intrauterine fetus. Yeah, that's the definition of ectopic pregnancy. When you put a probe on, we can find baby. History of pelvic inflammatory disease. Yeah, I mean, pelvic inflammatory disease scar the tube, and that prevent the egg from going through the tube and implant outside the tube. So this may have been a history before. That's all. Select and apply. Which of the following the nurse should anticipate will be prescribed? 35-year-old client presented infectious disease clinic with a new diagnosis of HIV requesting therapy. So I've been diagnosed with HIV and I need some medication. What do you anticipate? This is pharmacology. I intentionally put this question so I can give you some content. If you don't know this medication, just when you're studying pharmacology, classify those medications. Like I told you, we saw Zen for antipsychotic. You can classify all them to be able to identify them. Look at these last names. I put them together. Ding, ding, ding. Right? So you have Voudins. These Voudins, they're special. So you see Voudin, you have to know it's it's a HIV medication. So Voudins. Then the VL is always a viral. Okay, so that's fine. Then the Satabin, no, Tabin or Citabin. Yeah, you can use Citabin. It's another group. So you have 2 Citabin, you have Voudin, and the VL. These are all different kind of HIV that is used, a medication that is used. But I give it to you so that you can recognize them in case they ask. But look at You see, you can find the surname and remember them. And you can answer any questions. That's that one. All of them are above. Select or apply. A client sustained left anterior fracture and was prescribed crutches. Which of the following teaching is effective while non-weight bearing on the left? That means the crutches, you can't put a weight on it. So which of this is fundamental? Manage care. 3-point stand at all time. Yeah, if you are non-weight bearing, this is what you do. You go up with a good leg. So the good leg is the right leg. So this is good. Move the crutches and the left leg, the bad leg, when walking together. That's good. Support weight on your arm and your hands, not on your armpit. Otherwise, you get nerve palsy. Elbow is locked at 20 to 30 degrees. Yes. And then the crotches should be 20 centimeters apart. That's too far, like 15, 16 centimeters apart. So this is wrong. It progresses from 3-point, okay, to 2-point, then 4 to 4-point, where you have weight bearing as related, basically. So that's the progression. When you are non-weight bearing, you start from 3, 2, and 4. So this is good. So only one answer that is wrong. The rest, these are your answer choice. So they ask you to which teaching is effective. Pick those. Yes, don't pick that in your system. Select or apply. A client presented to the medical clinic for evaluation. The next should include which signs as risk factor for suicide. Who is at risk for suicide? Somebody who is hopeless, yes. If you live alone, you're not married, yes. If you have bad chronic illness, yeah. If you have no job, yes. If you are elder of a church, that means church association. That means you serve in your community, no. Access to firearm, yeah. If you have gun, yeah. Prior attempt, if you've done this before, it's more likely you'll be able to get it successful. If you have substance abuse issue, yeah, that's the problem. The family history of suicide doesn't help either. And the history of mental health disorder will be warming. So that's not good. So these are the risk factors for suicidal ideation and suicide. So I just put it there so I can give you all the content you need. Okay, almost done. 30. Which factor poses the most risk? Select and apply. A mother asked the caring nurse the risk factor for testicular cancer. So what do you think? Usually the age, this age is the most common between 15 to 35. This age is the most common age. This is also within the same age 25, but this is the best age group. 35 usually is very low, but it's all depend on where the testicle is located. If the testicle is in the scrotum, it's better, but your chances is still high until you pass that age. But undescended testicle that has not gone down into the scrotum is a problem. So undescended, which is the same thing you can say inguinal testicles. When you pull your hand in the inguinal region, you feel a testicles there. That's the same. That's what we call inguinal and testicle. It has not descended yet. It's descending, but it has not made its way. And the undescended means it's made its way. So those two are the right answer. Okay, we almost done. Teach, select, and apply. And then a client was diagnosed with active TB and need therapy. Which of these medications are matched with the effect the nurse will teach the patient at discharge. So medication match with the effect that you're going to teach them, what they should expect. If they need to follow up with certain things, yeah. If you take rifampin, yellow secretion, that's okay. Isoniazid, you have peripheral neuropathy, excellent. In Tabitol, you have optic neuritis. Streptomycin, you have autotoxicity and nephrotoxicity. Pyrazinamide, you have hyperuricil. That's another medication for NTB. So this is the content for that particular area, TB medication, and their major side effect. So I hope you got that in case they ask you somewhere. So let's apply. And this is teaching a client about transmission of hepatitis and complication. Which one is paired accurately? So Hep A is by fecal oral route, no cancer risks. B, body fluid and liver risks, cancer. C3, Hep C, IV drug user, and then liver cancer. And 4, body fluid, no cancer risks. So what do you think based on what we have? Which one is paired accurately? This is fecal oral, and there's no cancer risk, so that's good. A B, the B is this, your boy, body fluid, and there's a liver cancer. Hep C is a drug use, IV drug user is the most common. Sharing needles is the number 1. And also causes liver cancer. D, it get co-infected with B, so this guy can go together. So body fluid and no cancer risks. So this is the questions they can ask you about hepatitis and individual and their risks of cancer. Next one. Same thing, pharmacology. And this is providing teaching to a new graduate about tocolytics. Which of the following the next should include? The way the words sound, you think you're speeding up. No. Every time you see this word, say, hey, I need to slow things down. But the words sound like outgoing things. It doesn't sound like it. But the best way to remember these things was slow down the uterus to prevent contraction is anti-prostaglandins. So PE, anti. What is an anti-prostaglandins? That is NSAID. So indomethacin is good. Magnesium is also good. This is a bronchodilator. It's also used as a tocolytic, so that's good. How do you stop contraction? Block calcium. So don't worry about saying the Phototherapy cream. Yeah, because it's supposed to see it's a calcium channel blocker. And nitroglycerides also are very good. Then you got to block the medication that or this almost that causes contraction, oxytocin. Okay. And these are the medication that blocking. Atosiban. They have the last name Siban, Boresiban. They bind to it. So they bind to this guy and they block it. So those ones are good. This does not slow down the heart. Their contraction is speeded up. So this one is wrong. So all of them except oxytocin is the right answer. Few more. Selected apply. Back to delegation. RN, LPN, UAP are caring for a client on the surgical unit. Which tax is appropriate for the UAP? UAP, like I told you, They don't think things that doesn't. They think it's just for the test, so that you can recognize them. Things that doesn't require thinking. Okay. They don't touch stomach, so they are not responsible. They can weigh the patient. They can watch patient just eating so that they don't get out of bed or something. Check blood glucose before meal. Yeah, they can check your blood glucose before you eat. They don't need to do any assessment. They just checking. Reinforce teaching. No, they don't reinforce. Educate client. They don't educate. And that's the way you do it. You just look for big words and the buzzwords and then use it to like eliminate as much as possible. Okay. $35. Two more questions. Oh, that's the last one. Last question. Let me see. I think I did 34. Okay, that's the last question. And this is providing education to a new graduate about antidotes. Which pairing is accurate and should be included in the teaching? So this is the bonus. Antidotes, which one is accurate? Acetaminophen, yeah, acetylcysteine is what you need. Mucomist. Digitalis, Digio5. This is good. This is good. Lead, EDTA. Heparin, not vitamin K. It's protamine. Coumadin, vitamin K, not protamine. Opioid is no. Fentanyl, fentanyl is another opiate. It's naloxone. This is the end of it. Thank you for going all the way. I hope you learned something. Keep charging as always. These are ideal questions you will love. And you thank yourself for watching that far. Thank you. If you're not subscribed, just subscribe. Check the link down and just click subscribe. Put your notification on that I can get you more content that you need. Thank you for your time and all the best of luck. Bye-bye.